In Forsyth County, a proposed 8-bed Novant Health Emergency Department could be coming to Robinhood Road between Polo and Peace Haven, but not everyone is excited about it. Sarah Sowers was the only TV reporter in that meeting in Kernersville today and shares what folks on both sides of the aisle had to say.
Traffic and safety, those were the top two concerns echoed by nearly 50 Robinhood Road area residents who say that they're in opposition of a new proposed Novant Health Emergency Center.
If you're going to put in a facility that's going to bring in more traffic, more chaos into the neighborhood, what's it going to do to the people who live there?
Some people who live near Robinhood Road in Winston-Salem say they're unsure about the proposal.
I'm not opposed to a satellite ER. I just don't know if this is the right place.
Proponents of the Novant Health Emergency Department expansion spoke up about why they're in favor of the project.
The need for this project is grounded not only in data, but in the everyday realities of this community.
An emergency room doctor offered his support as well, saying it would alleviate local hospitals' demand.
Last year, Forsyth Medical Center saw a little over 77,000 patients in the ED. To get that access sometimes takes 6 to 10 to 12 hours. If we can see people outside of the main emergency departments and see them in the smaller facilities, then we can improve the access to the high-level care at these tertiary care centers.
And the landowner, who would be leasing the 4-acre property to Novant Health, said zoning options like a 200-unit apartment complex or fast food restaurants would make traffic in the area even worse.
All of which generates significantly more traffic than what Novant is proposing. This is truly a traffic calming use for this site compared to the other uses.
Others brought up the approved Atrium Health Wake Forest Baptist Emergency Care Facility that's coming to University Parkway, and the redundancy with Novant's other proposal to add 63 beds to their main Forsyth hospital.
Having a Forsyth facility and a Baptist facility will provide more choice, more competition, but will leave both facilities inefficiently splitting those potential 17,500 visits between two facilities.
So I don't believe that you can cite an emergency demand 4 miles away, then expand the hospital to meet that demand, and then call this particular project necessary.
Sarah Sowers, WXII 12 News.